I first started to hear voices, which are considered auditory hallucinations. I also developed severe anxiety and depression, and a lot of paranoia as well.
Schizophrenia is a pervasive neurodevelopmental disorder that affects individuals and their ability to feel, to think, and to perceive reality.
So your mental capacity to maintain memory and to maintain your emotions and to maintain all of that just went completely down the drain because I couldn't focus on anything.
Schizophrenia develops in individuals who have a family history of the illness. They generally will have a first or a second degree relative with the illness or with other psychotic illnesses as well.
In terms of focusing on studies, I think it was a huge hindrance as well because in university, voices sometimes would emerge, or I would get anxious, or I'd start to get depressed.
Schizophrenia is a chronic illness. It is a lifelong condition. We do not have a cure for schizophrenia right now, but we do have excellent treatments that can enable individuals with schizophrenia to achieve functional recovery.
Ever since I was diagnosed, I tried about 4 to 5 different oral medications. I was able to maintain one that worked effectively, but once that medication stopped working, I tried at least 4 more.
Medication is the cornerstone in terms of the treatment of schizophrenia. Evaluate its efficacy, evaluate its side effects, always talking about medication at each appointment that I have with my patients.
I'm currently on one of the newer medications that helps me maintain recovery and wellness really well.
What's the best medication in terms of functional recovery, quality of life? And that is a medication that is taken regularly and has the fewest possible side effects.
It maintains a level of recovery that has really worked for me.
I have seen some very significant improvements in our treatments available for schizophrenia.
There's so many things going wrong in your body, in your mind when you're mentally ill. And without medication, when it gets really bad, there's no out. You really need to maintain that chemical balance through the medication.
Adherence to medications in individuals with schizophrenia is the most important element in terms of overall prognosis and recovery.
My quality of life is amazing. It is flourishing, it's rewarding, it's motivating. It's been several years where I haven't had any full-blown symptoms.
I think the outlook for the future of schizophrenia is excellent. We have great treatment strategies now.
With the help of my parents and my family and my doctors and my medication, I am living a fully successful life.
The best outcomes that we can achieve is with the early diagnosis and early treatment and effective treatment of schizophrenia.
People with schizophrenia can have relationships, and they can flourish, and they can maintain a job, and they can have a family. I'm happy, and that's the main thing, is that I'm happy.
Always be respectful of the individual and instilling hope in the future.
To learn more about schizophrenia and other psychological conditions, visit these websites. On May 24th, schizophrenia organizations from all over the country unite for World Schizophrenia Day. On this day, we urge Canadians to open their minds, cooperate, discuss, and work together to reduce the stigma around schizophrenia and mental health. Be sure to use the educational resources below and join the conversation on mental illness in Canada.